And I asked our healthcare workers today, what can we do as a society to help them? And they all pretty much told me the same thing. Get vaccinated, get boosted, and if you do catch COVID, don't necessarily run to the hospital right away, as long as you can manage your symptoms from home. Across the state, nearly 2,000 people are hospitalized for COVID, including 535 across Hartford Healthcare. 67 are in the ICU, 50 are on a ventilator, but there is good news.
The state is +5 for ventilators, and they're going to be +36 for ICU. But the good message is that for the first time in a long time, we've had a decline of -22 for hospitalizations across the state.
To another major state healthcare provider, Yale New Haven Health, telling Fox 61 their biggest issue isn't beds, it's staffing. Staff outages peaking January 5th, when more than 730 healthcare workers had COVID, now below 600.
We've also put in some staff incentives in areas that are short-staffed, and that has had, it's been really a resounding response from our employees taking up those incentives and working across sometimes different hospitals, but different cost centers, different areas.
With President Biden surging military medical personnel to 6 struggling states, do we need that here?
Any assistance that we can get would be welcome, and we'd be able to ramp up our operations even more.
And do we need to bring back the mobile field hospitals?
Many of those field hospitals really saw very little use.
So the fight continues with vaccines, antibody therapies, and COVID pills. A fight that's taken its toll on the morale of our healthcare heroes.
It's a challenge. I'm not going to lie to you. Our nursing staff is some of the strongest individuals I've ever met in my life, and I've seen several of them in tears when the volume was at its highest. And we're there for each other.
Yeah, so important to thank our healthcare workers. And when it comes to those new COVID treatments, the antibody therapies, for example, hospitals tell me those are still in very short supply. Some hospitals actually ran out and were waiting on shipments, so they've had to prioritize their use mainly for high-risk patients, the elderly and the unvaccinated. We're live outside Hartford Hospital. Matt Caron, Fox 61 News.